Chapter 34, Drugs for Urinary Tract Disorders, is the last for this week, week 5. I'm sure you're thrilled to finally have it over with. This is a very simple, brief chapter covering a few things with the urinary tract disorders. So we're going to start with urinary tract infections. They can be a cystitis, which is the lower urinary tract, or they can be acute pyelonephritis, which goes up into the upper part of the urinary tract. They can be bacteriostatic, where they stop the growth, or bactericidal, where they kill the growth. It can be for spasms or for problems with muscle tone. Nitrofurantoin, which you should be familiar with on the drug chart 34.1. I would definitely look over that. Nitrofurantoin, a lot of people will call macrodantin, is very common because it kills E. coli, which is very common for urinary tract infections, which I said more than once. It is given orally. If you'll notice on your dosage, it has an adult and child dosage. It can be given for anybody over 1 month old, but be sure to note that it does cross the placenta and it's excreted in breast milk, so those are some contraindications. It's excreted in the urine, a little bit in the bile, and GI absorption is enhanced with food, so you will instruct them to take it with food. It works by inhibiting the bacterial enzyme and metabolism and inhibiting the bacterial cell wall formation. It does cause the urine to turn a rust brown color, so that's something you want to warn the patient so they do not get scared. Some other side effects are GI, such as anorexia, nausea, vomiting, abdominal pain, some neurological things such as dizziness, headache, drowsiness, depression. Watch for superinfection or a severe allergic reaction with angioedema, some blood dyscrasia, some neurological effects. It can be a life-threatening anaphylaxis. It can cause damage to the liver, especially in higher doses or long-term. Let's see, what else do you need to know on this? We're going to move on here to methamphetamine. Understand that it is for chronic UTIs, and it can cause crystallization if it's given with the sulfonamide, such as trimethoprim, methoxazole. Sorry, tongue-tied. You want to encourage any UTI to drink cranberry juice unless it's contraindicated, because the more acidic the urine is, the better the medication will work. Look over your nursing process for nitrofurantoin on page 462. And it does mention the cranberry juice. Let's see, move over to your next page. Trimethoprim and trimethoprim sulfamethoxazole, what we know as Bactrim or TMP-SMZ, is the abbreviation for that combination. We just discussed it in chapter 31, and the fluoroquinolones, which we discussed in chapter, can't remember what chapter that was, just a couple of chapters ago. Fluoroquinolones like the ciprofloxacin, remember all the fluoxetine, so I'm not going to go into it again here. Just know both of those can be used to treat urinary tract infections. A note on the bottom of page 463 on nitrofurantoin. Another possible side effect is pulmonary reactions such as dyspnea, chest pain, fever, and cough, which would need to be reported immediately. Drug-drug interactions, you'll see that antacids decrease nitrofurantoin absorption. Down to urinary analgesics, phenazopyridine, which is for pain. As you note here, it says it's an azo dye, so it does cause the urine to turn like a brown red. You will have somebody come in complaining of your UTI type of symptoms. You'll get urine, it looks bloody. You need to ask them, because it will turn it that color. You can get what's brand name Azo over the counter for that discomfort. So I've had patients come in requesting a script for pyridium, which is phenazopyridine hydrochloride, but you can get it over the counter. A lot of times now insurance won't cover it anyway because you can get it over the counter. It relieves that pain and burning, especially with the UTI. I advise people not to take it more than the first 2 days. As you'll note here, it can cause hemolytic anemia, nephrotoxicity, hepatotoxicity. So that is why I advise them only to take it the first couple of days to help with that painful urination, while the antibacterial or bacteriostatic is at work. Urinary stimulants, that's when you have a neurogenic bladder. For some reason, the bladder muscle does not contract. So they were given bethanochol chloride to stimulate micturition or urination. The other name for this, the brand name is Uricoline. You should remember that name from when we covered autonomic nervous system. It is a parasympathomimetic, so it works on that parasympathetic side or the cholinergic side. It's a cholinomimetic, where it helps with that relaxing stuff in chapter 19. If you need to, go back and look at that. As you notice with pharmacology, everything builds on everything. So hopefully you get a good basis as you go along, grasp the things, make tricks for yourself to remember, because they're going to keep repeating and building. Urinary antispasmodics. I'm just going to flip over here because I put some funnies, and this relates to this one on the right. Sometimes nature not only calls, she makes an emergency breakthrough. So that's really cute when you talk about the antispasmodics here. And you have this urinary incontinence, overflow, stress, and urge to help give you a better understanding. So over here on your antispasmodics, they have a direct action on smooth muscle of the urinary tract. If you remember talking about the antimuscarinics, which are ones that block the parasympathetic, or anticholinergics from chapter 19. Most common ones are oxybutynin and flavoxate. Those are two you will see often. And the side effects, of course, are blocking that parasympathetic side. So they have the dry mouth, increased heart rate, dizziness, intestinal distension, and constipation. Instead of relaxing everything, it tightens everything up. Tolterodine tartrate is an antimuscarinic, anticholinergic drug often used to control overactive bladder, and it causes a frequency in urination, decreases that incontinence urge. You want to look at this table 34.2, teaching on these drugs, antispasmodics, antimuscarinics. Teach them to report urinary retention, severe dizziness, blurred vision, palpitations, and confusion. And that actually is the end of this chapter and the end of this week's lectures. Thank you.